All right, we're going to begin our final topic, which is healthcare. What I do now have, it was down before. It's back up again. That's the link to the film, the Michael Moore film Sicko. So that's a free link. If it's working, that's great. You'll be able to watch the film for free. If not, then you'll need to rent it from Amazon. I think it's a couple of bucks to rent it for 2 days. It's a 2 hour film. You absolutely have to watch this film. It's of critical importance to not only this lecture and understanding where we are at in terms of American healthcare, but it's also very important for the final exam as well. So make sure you view the film. Now, there's a worksheet uh, in your content folder. It's called the Sicko either worksheet or the Sicko viewing sheet. I forget exactly how I labeled it. But this is what you have on that sheet. A summary of the Affordable Care Act, the Patient Protection and Affordable Care Act of 2010, what is commonly referred to as Obamacare. And what it is, by and large, it does two things. One, it regulates insurance companies, health insurance companies, and I'm going to show you how. Secondly, the Affordable Care Act mandates that all Americans have health insurance. And in order to achieve that, it does two things. It expands the federal government's role in providing Medicaid. I'll talk about that later on. And it also provides subsidies for people to purchase private health insurance based on their income level. And I'll describe that later as well. What you all need to know, and you probably do already, is that this act was passed in 2010 without a single Republican vote in either the House or the Senate, and Republicans have vowed, since it was enacted in 2010, to repeal it and replace it with something better. They had the opportunity to do that in 2017 when they controlled both houses of Congress and had Trump as a Republican president, and they were unable to repeal it, and they have yet to put forth a comprehensive replacement plan. And that's largely why they were unable to repeal it, because they really do not have a comprehensive plan to replace it. So we'll talk about those issues later on. But for now, this is what the Affordable Care Act has done. Let me back up. Coverage for adult dependents until age 26. Most of you are under 26. I would imagine that most of you are still covered on your parents' family health insurance plan. And you will be covered until you turn 26. When you turn 26, you will no longer be on your parents', excuse me, you would not have been on your parents. I'm sorry. Let me back up. When you turn 26, you will no longer be on your parents' plan. Prior to the Affordable Care Act, when a dependent child turned 19 in most states, they would be off their parents' plan unless they were a full-time student. Then they could remain on their parents' plan until age 23, or until they were no longer a full-time student. Then they would be dropped. So when my kids were growing up, it was before 2010. When they turned 19, I had to provide my insurance company with documentation that they were full-time students, and as long as I did that, they remained covered. The Affordable Care Act moves it to 26, whether you are in school or not. So that immediately provided insurance coverage to something like 1 million young adults across the United States. Children under 19, and now it's or everybody, because we're beyond 2014, can no longer be denied coverage for pre-existing conditions. You're going to see some examples in the film Sicko of people being denied coverage for pre-existing conditions. A pre-existing condition is any health condition that you have that might have or may in the future require medical attention prior to seeking health insurance. That's a pre-existing condition. So common ones are things like diabetes, asthma. If you have a heart condition, it could be many things. This will be something that you'll see in the film Sicko. No American today can be denied health insurance because they have a pre-existing condition. Now, keep in mind, this applies to everybody. Prior to the Affordable Care Act, the people who were being denied coverage were people who were seeking individual plans or plans on their own. If you were getting group coverage, as a large percentage of Americans get their coverage through their employment, as part of a large group, the pre-existing condition limitations did not apply to them because they were part of a large group. But for individuals seeking coverage on their own, this was an absolute obstacle if you had a pre-existing condition. Remember, we're talking about private insurance companies. They're private businesses. They exist for one reason and one reason only, and that is to make profit. And profits benefit investors in those companies. Insurance companies, whether it's a health insurance company or an auto insurance company, they want to collect premiums, but they do not want to pay claims. And so anybody with a pre-existing condition, especially if that pre-existing condition is a chronic condition like diabetes, those people become very expensive to cover because they're going to constantly make claims, needing to see doctors several times a year to have their blood levels monitored, needing to take prescription medications or insulin or have some other type of therapy. So insurance companies don't want to insure people who are going to make claims. Just like auto insurers really don't want to insure people who are bad drivers. The same thing applies here. But under the Affordable Care Act, people cannot be denied, nor can their rates be increased because they have pre-existing conditions. It prohibits insurers from rescinding coverage. As you watch the film Sicko, you're going to see examples where people had health insurance only to find the insurance company rescind their coverage when they needed it the most, when they were in line for some very expensive therapy and the insurance company finds some reason to drop their coverage. That can no longer be done. The Affordable Care Act provides everybody with health insurance with certain preventive services, such as mammograms and colonoscopies, which are cancer screenings, with no copay, no co-insurance, no deductible, no out-of-pocket costs. The Affordable Care Act lists a whole range of different things that are considered preventive or essential care that must be provided in every insurance policy. And preventative care has to be provided with no copay, no deductible. Let me define those terms in case they are not familiar to you. With private health insurance, there are three out-of-pocket costs. One is the premium. That's the annual cost of the insurance. The second is a copay. which is usually a relatively small fee, anywhere from $5 to $50 typically, that an individual must pay out of pocket when they receive medical care. So you go to a doctor, you might have a $15 or $20 or $50 copay. You get a prescription, you're going to have a copayment, and some of those copayments could be much higher than $50 depending on the cost of the prescription drug. And then the third thing is a deductible. A deductible is an amount of money that you must pay for health care before your insurance coverage takes over. So for example, if you have a $3,000 copay, a $3,000 deductible, that means that the first $3,000 in medical bills that you get in a year, you must pay those out of pocket. After $3,000, then your insurance will kick in, and then you'll have your copays to pay, but you'll have met your deductible. Generally speaking, the way it works is the higher the premium, the lower the deductible. So either way, you're going to have to pay significant money out of pocket before your insurance takes hold. Either that's making your annual premium payment plus your deductible. We'll talk more about those later on. We look more specifically about how health insurance works and how it affects the way people use it. I'm going to back up a second. The free preventative care is a very important notion. The idea is, if people can detect an illness or a condition early, it can be treated at relatively low cost. If you wait until you're symptomatic, oftentimes the cost of care becomes astronomical. I'll give you an example. Colonoscopies. Colonoscopies are cancer screenings. If you catch a colon cancer very early, the cost of treating it is very low. In fact, you could be treated for your cancer colon, and it could be completely remediated at the point of a colonoscopy. And I know that because that happened to me. I had colon cancer. It was discovered at a colonoscopy in a very early stage. There's a cancerous polyp. The polyp was removed. The cancer never came back. Had I not had the colonoscopy and waited until I was symptomatic with colon cancer, then it would have been very expensive to treat, and it might not have been treatable. So in terms of saving money, and more importantly in terms of saving lives, preventive care is essential. There's an old saying, an ounce of prevention is worth a pound of cure. And it's very apt here. If we can prevent illnesses from becoming advanced, we can treat them more effectively and much less expensively. So it's an ironic, it's a counterintuitive notion when it comes to healthcare. The more people use it, the less expensive it ultimately will be, because we'll catch diseases and other kinds of health problems early when they are treatable in a very inexpensive way. So preventive care is a feature of all insurance policies now because of the Affordable Care Act. It never was true before. And it ends lifetime limits on coverage. Some insurance policies would have dollar amounts associated with them, $1 million worth of coverage or whatever it might be. And once you hit that limit, you were no longer covered. So if you needed something very expensive, a heart transplant or a lung transplant or something along those lines, you were going to hit that lifetime limit on your coverage. And once you did, then you no longer had coverage. You had to pay out of pocket. So at the point when you needed your insurance the most, it would be taken away from you. That can no longer be done. There cannot be policies that have lifetime limits on coverage. Unrestricted doctor choice. This eliminates the requirement for patients to get prior authorization from their insurer or a doctor's referral to see a pediatrician or an OBGYN. So now new parents can take their newborn to whatever pediatrician they want without having to get approval from either their primary care physician or from their insurer. The same thing is true with OBGYNs for women's health. Level charges for emergency services. Insurers must remove prior authorizations for emergency room services. Also, insurers can't charge higher co-payments or co-insurance for out-of-network emergency room providers. You'll see an example of this, a couple of examples of this in the film. I experienced this shortly after I was married. I was very young. I was 23 years old. I was at the beach in Long Beach throwing a frisbee around, and I ran to catch a frisbee, wasn't looking where I was running, and I ran right into the rock jetties, and I cracked a bone in my lower leg. I was taken to the emergency room at Long Beach Hospital, and I was told by the emergency room physician that I had fractured my leg and that I needed surgery. They had to open up my leg, and they had to debride the cracked bone. And I told the doctor, can't do that here because my coverage, this hospital is not in my network. I had to go back to my hospital in Queens. And he said, well, you can do that certainly, but you run the risk of the bone getting infected between now and then. And if the bone gets infected, we'll have to amputate your leg below the knee. What do you want to do, is what he said to me. What do you want to do? Do you want to pay out of pocket for whatever your insurance company won't cover because you're out of network? Or do you want to roll the dice and risk losing your lower leg? What kind of situation, of option is that? So I opted obviously for the surgery and then had to deal with the bills later on. The Affordable Care Act says that can't happen. If you're away, you're outside your network and you have a medical emergency, your insurance company is to pay that claim as if you are in network. That's a big deal. And then finally, the patient-friendly appeals process. While a claim is under appeal, your insurer has to continue to pay your claims and continue paying for subsequent treatment until the matter is resolved. Prior to the Affordable Care Act, and let me explain in case you guys aren't aware of this, necessarily, being young and healthy. When you see a doctor and a doctor tells you that you need a particular therapy, the doctor then informs the insurance company that you need this therapy, and the insurance company has to approve it. If the insurance company doesn't approve it, then if the doctor provides it, the patient has to pay for that out of pocket. So when a insurance company denies a claim, they are in essence telling their insured patient who's been paying them premiums that they're not going to cover this, and if you want this therapy, you're going to have to pay for it yourself. This has happened countless times You'll see examples of this in the film. Now, under the Affordable Care Act, when that claim is denied, and if you as a patient and your doctor both believe that it was unjustly denied, you can appeal it, as you could previously. But previously, when you appealed it, the claim was not going to be paid until the appeal process ended, which could take years. And if it turns out that, yeah, you and your doctor were right, then they would pay the claim. If the therapy that you needed cost hundreds of thousands of dollars, there are very few people that can pay for that out of pocket. Now, with the patient-friendly appeals process, the system is that you get the therapy, the insurance company pays for the therapy, and then if it turns out that they were right to deny it in the first place, then you owe that money back to the insurance company. But at least you can get the therapy when you need it. And you're going to see examples of this throughout the film Sicko. It's very important that when you watch Sicko, it was made in 2008, before the Affordable Care Act was enacted in 2010. That's what life was like without these insurance regulations in place. Consumers had very little recourse against the big insurance companies. The Patient Protection and Affordable Care Act attempted to give patients some rights, give people access to insurance coverage that was going to be actually beneficial to them. So, when you watch the film, you'll be looking for examples where things were happening before 2010 that can't happen today because of the Affordable Care Act. And I say today, and that's, keep in mind, that's tentative. The Affordable Care Act is going to be reviewed by the Supreme Court soon, and it could very well be that the Supreme Court says that this law is unconstitutional, in which case it disappears. And then we go back to what it was like described in the film Sicko, and also what it was like described in the PBS documentary Sick Around the World. The thesis of the film Sicko is it compares American free market capitalism to Canadian and Western European socialism. And it concludes that American healthcare would benefit greatly by adopting Canada's and Western Europe's all for one and one for all ethos embodied in their versions of socialism. That's the thesis of the film. As you watch the film, think about the extent to which you agree with this aspect of Sicko's thesis. The other thing I'll say about Sicko is I plan to show it in class, as I have been doing for many years. Since I first saw Sicko in 2008, I've been showing it to students. The response from students is very favorable. It's a good film. They enjoy the film. As you watch the film, there are going to be parts of it that are going to make you angry. There are parts of it that are going to make you laugh, and there are parts of it that could very well make you cry because they're so sad. So it's a good film. You need to watch this